And joining us now is Dr. Stephanie Widmer with more on how to stay healthy.
And I just want to be clear that to date, there has been no research, no study that has concretely shown that fluoride, especially at the very low levels of fluoride we see here in the United States, have any direct impact on IQ levels or cognitive development.
So even though those concerns are out there, they have not been proven in any means.
Correct. Convergence of high levels of, just like you said, flu, COVID, RSV, and this norovirus. And there are multiple factors at play here that are being sold. They're colorful. They have catchy names. I mean, it's not being marketed to a chef. You're not walking into a smoke shop to buy something to make whipped cream. It's not something that people should be exposed to outside of a controlled professional medical setting.
For more, let's bring in emergency medicine physician Dr. Stephanie Widmer. Dr. Widmer, thanks so much for being here. How worried are you about these numbers that we are seeing out of Texas in that outbreak?
Last year, there were 285 cases, and we are up to 164 in the United States. We're seeing cases that have not necessarily been linked to the outbreak in Texas, but they're popping up in different states. So this was a very large study that was done out of Sweden, 220,000 individuals with a prior diagnosis of alcohol use disorder. And what the study looked at was these GLP-1 drugs like semaglutide, the active ingredient in Ozempic, and liraglutide, which is a similar drug to semaglutide. And what they found was that semaglutide showed a 36% decrease in alcohol-related hospitalizations in individuals with alcohol use disorder. Ketamine is a fascinating drug. It works by blocking what we call NMDA receptors in the brain. It can affect your mood. It causes sedation. It is primarily used as an anesthetic.
Dr. Stephanie Widmer is a toxicology and addiction expert who says ketamine is a powerful anesthetic that has been used in hospitals for decades.
Actually became very popular during the Vietnam War to help with pain and sedation, and it also quickly became used not just in human medicine but in veterinary medicine. It took until 1999 for it to become classified as a Schedule III controlled substance by the FDA, because really by the mid-90s it was all over the place. Ketamine is not a benign drug. It does have side effects. It can alter your vital signs. It can cause profound sedation and dissociation. What we're hearing based on this coughing fit, and he had an episode of vomiting during the coughing fit, and as you can imagine, if you're vomiting and also struggling to breathe at the same time, inhaling some of those gastric contents can cause inflammation. This is a little bit difficult, and I think for some people this might be confusing, the immediate cause of death. The cardiopulmonary arrest, I think that portion in particular might be confusing to some people, just because it almost sounds like a heart attack or almost sounds like an arrhythmia or something that happened with the heart, but really it's not saying a whole lot. It's saying he died.
Why the vagueness? Why can anyone say this is exactly how and why George Floyd died?
I think the issue is because, you know, he did not get to medical attention until after his demise. We don't have a single test or even an assessment of what was going on with him prior to his demise to tell us exactly what was happening inside of his body. There's no one test to say, oh, did he have a heart attack? Or, you know, was he asphyxiated? I don't know what his oxygen level was. I will never be able to say exactly what his heart rate was at the time. There's just so many variables that we will never have the answer to. Your clinical course can change at any given moment, and his medical team reports that while his condition is not currently life-threatening, they are still monitoring him very closely and continuing to take his condition very seriously. He's not on a breathing machine, which is great news, and despite his illness, he is reported to be in good spirits and appears to be making some progress in the right direction, but nobody wants to make any concrete calls at this time. Different strains, different things that are going on in the community. There's no way this could have been a heat-related illness. It was a very bold statement. There are essentially two types of hantavirus. There's hantavirus pulmonary syndrome, which primarily affects the lungs, and then a syndrome that primarily affects the kidneys. Vaccination rates are still incredibly low right now. Less than 45% of adults have received their flu vaccine. All you have to do is kind of put your hands at your side, look straight ahead, and just lift one leg. Now, what the study found is that there was a more rapid decline with your non-dominant leg, Okay, so if you are right-handed, you would want to try this on your left leg.
Interesting.
Okay.
All right. Okay, so I'm not doing too bad.
Okay, no, you're doing great.
Okay.
Amazing.
Good.
Okay, I'm not even.
I'm just going to say like this the whole segment.
Okay. Yes, and and if you're having trouble in the beginning, balance is something that really does improve with practice and with time, and so it's something that you can continue to do and get better at.
Awesome. All right. Dr. Stephanie Widmer, thank you so much for joining us.
Very
We
good.
so appreciate having you.
you.
Try that
Thank
at
you.
home.